Are employers thinking about comparative effectiveness research, or CER? Do employers care about it? How will they use it? And do they want CER to include productivity outcomes when it's appropriate? To answer these questions, the National Pharmaceutical Council and the Benfield Group teamed up to conduct some important research. During this brief video, I'll walk you through how we conducted our research, review the key findings, and finally outline our conclusions. We surveyed 75 jumbo self-insured employers in December 2010. Individuals who completed the survey were health benefit decision makers or decision influencers. To provide us with further insights, we held 25 follow-up interviews with jumbo employers, benefit consultants, and coalition leaders. The first question we asked employers was how familiar they are with CER. To make it clear about what we were asking, we provided respondents with a definition of CER. About 3/4 of employers surveyed were at least somewhat familiar with CER, while nearly 10% considered themselves very familiar. In follow-up interviews, we learned that news coverage of healthcare reform led to a moderate level of familiarity among most employers, and that information from benefit consultants and from the National Business Group on Health made some employers become even more familiar. So, most employers have at least some familiarity with CER. Do they expect it will be useful? The answer is yes. Specifically, 85% of employers we surveyed say that CER has at least moderate potential to improve their decision-making about employee health benefits. Nearly 1/4 believe CER's potential is strong. That's also because, as one employer told us, we want to pay for what works and not pay for what doesn't work or doesn't work as well. CER will help us do that. While employers expect CER information will help them make better decisions, how will they integrate CER into their decision-making process? To find out, we asked employers how they use information they currently have in making decisions. We learned that employers and their health plan or pharmacy benefit manager vendors are currently most likely to use information about clinical outcomes, utilization and costs, and safety in making benefit decisions. Relatively few employers currently use information about the impact of alternative treatments on lost work time or on-the-job productivity when making benefit decisions. In follow-up interviews, employers told us that while they would like to use productivity-related information in making benefit decisions, they either don't have the data or they don't have it integrated in a way that can inform their benefit decisions. So, what types of outcomes information within CER would be most important to employers? Two observations stand out. First, employers listed the same types of outcomes as before, clinical outcomes, utilization and costs, and safety, in the same order. This implies that employers will fit CER findings into their existing approach to analyzing data and using information. Second, a majority of respondents say it will be important for CER to include productivity-related information. In fact, 60% say it will be important for CER to factor in the impact of treatments on work performance, and 70% believe it is important for CER to provide information about absence, disability, and return to work. With this finding in mind, it's no surprise that 88% of employers say that it is important to include outcomes such as absence, disability, and work performance in CER results. We also wanted to know what actions employers will take once they have CER data in hand. To find out, we presented employers with hypothetical information about alternative treatments for two different conditions, low back pain and diabetes. These scenarios were general in nature and indicated that one approach was better than the other approach. Given this information, we asked employers what they would do about it. You'll see for both low back pain, the gray bars, and for diabetes, the green bars, that the highest priority actions for each condition are the same. Employers are most likely to educate and proactively steer their employees toward more effective treatments. Then, depending on the condition, employers will work with their vendors to modify coverage and implement value-based approaches to promote use of more effective treatments. Finally, we wanted to learn how employers are likely to remain informed about CER and the types of information they will find most valuable. When it comes to monitoring CER information, 6 in 10 employers expect to take a trust but verify approach and rely on their vendors, but they also want to stay informed on their own. 3 in 10 employers plan to directly monitor and interpret CER information as it becomes available. Who will employers look to for information? The 3 most reliable and trusted sources of CER information for employers in the future are the Patient-Centered Outcomes Research Institute, or PCORI, followed by health plans at 56% and benefit consultants at 48%. And when it comes to the type of CER-related information employers will be interested in receiving, they will most want to see examples of how other employers are using CER findings in making medical and pharmacy benefit decisions. So, what do all these results mean? When added together, we reached 4 conclusions. Number 1, employers are aware of CER and expect it to help them improve employee health and to manage costs. Number 2, CER findings will complement how employers currently use information, and employers can leverage existing tactics to drive CER findings into clinical practice. Number 3, employers will value CER findings that include the impact of alternative treatments on productivity outcomes. And finally, employers will rely on a variety of stakeholders, including PCORI, as their most trusted resource for CER information, and prefer information that is clear and actionable. I hope you'll download and read the full report, which is available on NPC's website. Thank you.